Welcome to Health Matters. I'm your host, Maeve Shaughnessy. In this new web series, we will focus on a variety of health and wellness topics for members of our local community, with input from experts here at Brattleboro Memorial Hospital. In this episode, I'll talk with Dr. Craig Rinder, urologist for Brattleboro Memorial Hospital. He will speak about men's health and answer questions submitted from viewers via Facebook. And he is coming up next. Welcome to the program.
Thank you.
So June is Men's Health Month, so let's discuss some common threats to men's health.
Of course. So men face some of the same medical issues as women as we get older, including the risk of obesity, diabetes, high blood pressure, heart disease, and so forth. And these are issues that are often silent until they become very advanced and serious and should be addressed at an earlier stage if possible. In addition to that, men have some unique health issues, including issues with prostate disease, benign prostate enlargement, which can cause problems with urination, difficulty emptying the bladder, and also prostate cancer, which is the most common solid tumor cancer in men in the United States. And the second, the number 2 cause of cancer deaths among men in the United States. So these are serious problems that some people are simply not aware of at all. In addition to that, there are issues with erectile dysfunction as men get older, and also the declining testosterone, which can have effects on emotional well-being, libido, sexual function, bone density, muscle mass, and many other biological and physical characteristics that men have as they get older.
So what would be some lifestyle changes to combat some of these threats to men's health?
Well, the first of these is that men have a tendency not to go to the doctor until they feel very sick. It's important that as men get older, that they have regular checkups with their physician, that they have a physician in the first place, and that if they notice some symptoms, something's changed, that they bring it to that doctor's attention and not wait until it's a crisis. In addition to that, regular exercise is very important for general health, as is a healthy diet and avoiding obesity, which can lead to many of these medical problems.
So actually, we've asked our viewers to submit some questions for you via Facebook. So viewers, thank you for your questions, and I'll read the first one to you. My husband has been getting up at night to go to the bathroom more and more. Is that change part of aging, or is this something more?
This is a common problem that is to some degree part of aging, and it's not unusual for many older people, men and women, to get up once or twice every night to go to the bathroom. But anything more than that starts to become a problem, and if he has difficulty getting back to sleep afterwards, or if it's very frequent, it may be an indication of an issue with urination, a problem with the prostate, a problem with bladder function, even more serious issues, including sometimes, rarely cancers, and stones in the bladder, things like that, that you would not be able to tell if you don't have an evaluation by a urologist.
Sure. So the second question, my brother has gotten into the habit of living a more sedentary lifestyle. What are the risks of this?
There are a number of risks associated with that. The lack of exercise tends to lead to obesity and weight gain, which in turn can result in diabetes, increased cholesterol, high blood pressure, and many other medical problems that derive from that. It's also not very good for bone health. The joints and so forth tend to deteriorate if they're not used regularly.
Sure. Well, great. Well, thank you so much for joining us today, Dr.
Thank you
Rinder.
for inviting me.
So if you have questions about men's health or would like to schedule an appointment with Dr. Rinder, please call the office at the number listed below or visit us online at bmhvt.org. That's all for this time. Catch us next time on Health Matters.